मेरा नाम बबीता जैन है। मैं मुंबई में साउथ मुंबई से हूँ और मेरी बच्ची का ये जब प्रॉब्लम मुझे पहली बार नोटिस हुआ करीबन 4 महीने पहले, और तब ये सिर्फ हम्प दिखने की वजह से मैं मेरे फैमिली डॉक्टर को मिली, हिमांशु शाह। तो उन्होंने बताया कि आप ये स्पाइन सर्जन से मिलना पड़ेगा आपको। तो उन्होंने मुझे संभव शाह का नाम सजेस्ट किया। फिर मैंने गूगल पे सर्च करके यहाँ पे SRCC में फ़र्स्ट टाइम मिलने आई उनसे। उन्होंने पूरा उसको चेकअप करके मुझे बताया कि सर्जरी के अलावा कोई ऑप्शन नहीं है इसका, क्योंकि इसका 52 डिग्री जितना बैंड हो चुका है, तो इसे सीधा करने के लिए सर्जरी एक ही ऑप्शन है। तो उस वक्त तो हमें बहुत डर लग रहा था, लेकिन फिर बाद में हम लोग 2 बार संभव शाह से मिले, हमारे जो भी डाउट्स थे सब क्लियर किए और फिर यहाँ पे SRCC में ही इसका सर्जरी हुआ।
Hello, my name is Geet Jain and I'm 13 years old. I underwent a scoliosis surgery on 20th January and I was having 52-degree bend in my spinal cord, so Dr. Sambhav Shah corrected it.
Hi, I'm Dr. Sambhav Shah, consultant spine surgeon at SRCC Children's Hospital, managed by Narayana at Haji Ali in South Mumbai. Geet came to us around 4 to 5 months ago when her parents noticed that there was something wrong with her back. What was wrong was in their words, that there was a big swelling on her back. This was the first thing they noticed. So she was brought to me at SRCC, and when I saw her, what it was basically that from the back, her ribs were protruding out on the right side. The left side was quite flat, but the right side was protruding out. She also had some unevenness in her shoulder. One of her shoulders was higher than the other shoulders. When I saw her from the back again, her skin creases, her skin folds were mismatched. Now, as a clinician, as a spine surgeon, my immediate diagnosis was that this was scoliosis of the spine. Scoliosis is a condition in which the spine starts bending in the coronal plane. That means if the spine is supposed to be straight, it starts curving as the child grows or as the height increases. Now, Geet was 13 years old, and on the X-ray we saw that her curve measured almost 52 degrees. As compared to her parents, Geet's height was still not even around her mother's height. That means that she was going to grow tall. She being 13 years of age, and there are a few other signs we see on the X-ray which gave me information that Geet's height is going to grow, and if her height grows, this curve is going to increase, and there is a possibility that at 17 she may even become 70-80 degrees, and the deformity becomes even more bad. You feel like a big hump on your back. The patient completely gets turned like this. And surgeries at that stage are even more difficult. So I advised Geet and her parents that Geet needs to undergo a surgery which is called scoliosis correction. My main indication of surgery was not to make her straight, but my first indication of surgery was that the curve does not grow further. Obviously, we try and achieve as much correction as possible in the theatre, keeping in mind the patient's safety first.
और SRCC में 10 दिन हम लोग यहाँ पे रहे, उस बिटवीन इसकी सर्जरी हो गई और हॉस्पिटल में भी हमें हर तरफ से बहुत अच्छा सबका साथ मिला, और डॉक्टर ने तो बहुत अच्छे से इसका ऑपरेशन के बाद जो भी कॉम्प्लिकेशन हुआ उसमें उन्होंने इतना सपोर्ट किया कि सब कुछ ठीक हो जाएगा, आप टेंशन मत लीजिए। और फर्स्ट डे एक्सरे करवाने पे पता चला कि उसका तो जो इतना टिल्ट हुआ था बोन एकदम सीधा हो चुका है, और डॉक्टर ने तो हमें मतलब बहुत अच्छे से संभाला हम दोनों को, क्योंकि हम लोग दोनों बहुत डरे हुए थे और डॉक्टर ने हमें बहुत अच्छे से संभाला, और उन्होंने जो कुछ कहा ना वो सब कुछ इसके साथ में सच में हो गया। हम इससे बहुत खुश है कि मतलब इसकी जो प्रॉब्लम थी उसे ऑलमोस्ट उन्होंने नील कर दिया।
At SRCC, we have all the facilities available to make the surgeries more and more safe, right from navigation guided spine surgery and obviously neuromonitoring. We are also a team of spine surgeons here, and we operate the patient together, which makes the surgery much more safer. Geet underwent a 4-hour surgery in which we put screws and rods in her spine and we made her spine straight. Post-surgery, Geet was doing well. Complications post this surgery, and the most dreaded complication post the scoliosis surgery, which everyone is worried about, is paralysis of both the legs. However, neuromonitoring intraoperatively and with good physiotherapy post-operatively, majority of the patients don't have to face these complications. Geet's post-operative stay in the hospital was otherwise uneventful, and she was walking on the second and third day. She was undergoing vigorous physiotherapy, and now she's come to me for a follow-up. Her spine is much more straighter. Her post-operative x-ray is almost straight, and she's doing very well.
Sambhav Shah is a very humble doctor and he's very friendly to us, and he's a very nice doctor, and now I'm very happy with my bone and I'm very happy with my surgery.
The problem with scoliosis is that when it's neglected, a lot of parents are wary about spine surgeries. They think that the patients will get paraplegic, their legs won't move. And in that we see, especially in India, that a lot of children are brought to us at a much later stage, when they are 18, when they are 20, or when they are about to get married. And at that point of time, the curves are much larger, they are much stiffer, and then they're more difficult to correct, and the surgery becomes more complicated. I think hats off to Geet parents that the minute they saw it, they took action, they took the right approach of going to the specialist, and as she was diagnosed at the right time, the surgery was offered at the right time, and this will save a lot for her future. Just a few tips for the parents to just see their children on a regular basis. Look for uneven shoulders, look for uneven skin folds in the back, and if you find any of these signs like a hump on the back, then immediately consult the nearest specialist. If scoliosis is caught at the right time, a lot can be saved, because based on the curve, it's not that only surgery is required. A lot of patients, we just observe them, and if we feel that this curve has a chance to increase based on their age, only then a surgery is offered, and the results of the surgery are beautiful, and the patients are very happy after the surgery. Thank you.